I think if you're hesitant about leaving your facility or your current position to come into home care, you need to realize that it continues at home. There can be critically ill children at home. There are children with lots of needs and are very, very busy at home. I just recently went out to a house and did a sub-Q IVIG infusion, which you would think you can't do that in the home setting, but we do. So there are things that are ongoing in the home that you do in the hospital that you're not even aware of. And it's really cool to be able to still do them. And then you're teaching people too. So you're teaching the nurses how to do it. So it's very, very rewarding, and you can keep up your skills as long as you want them to, because you're always going to have that child or that other client that's going to require high-tech needs.
I thought I was going to be bored, and I found out it was just the opposite.
It's not just about the medical. It's not just about the medical care that you're providing. It's caring for the whole client, and spiritual, environmental, just it involves so much more, and the long-lasting relationships that you can make with that particular client and the difference that you make being there in their home on a daily basis or weekly basis.
At one time, I was the nurse who was working in a hospital thinking about getting into home care. So my advice would be that things don't really change. You just really get to take good care of one person. And in the roles that I have in the company, one of the things that I enjoy doing is taking my students to our clinical rotation. And I feel like I really get to get my hands back in there and really work with clients, and that's fun for me. So you don't lose it. There's so many different jobs that you can have within the company, and you can still keep your skills set up.
If I was talking to a nurse who is hesitant about leaving the hospital, I would share my story and countless other stories about the wealth of opportunity that is provided to nurses at BAYADA. I remember being a nurse at the hospital and thinking that my career path with the hospital was going to take a really long time, and coming to BAYADA and having others see potential in me and giving me the tools needed to grow and advance very quickly as a nurse is very unique in the nursing industry. I would tell a nurse, come check us out. We have a number of opportunities, both on the clinical side and also on the administrative side, opportunities that will not be given as readily to you, if ever, at the hospital. I would say, give it a go. You won't regret it.